So, COVID-19 has impacted all our lives in a tremendous manner, and it changed our lives forever. And I think initially, and even still, there are a lot of unknowns in this field, but we have made a great progress in the treatment and in vaccinations, and knowing more how coronavirus affects patients with kidney disease. One of the things is that it did limit the in-person interactions, especially for patients, when we are seeing patients in clinic or when we are seeing patients in the dialysis units. So that was the first impact which we had, and everything got converted to televisits and virtual visits. But now things are normalizing in the sense we are getting vaccinated, patients are getting vaccinated. So things are looking brighter now. But yes, it did impact us in a tremendous manner. So we continue to advocate for patients with kidney disease. There were a lot of health disparities which were seen, especially in the United States, with patients of Black race and ethnicity, where COVID-19 had a greater impact, or those patients had more severe manifestation of the disease. However, one of the ways it impacted advocacy was use of limited use of in-person avenues and higher use of virtual platforms. At the same time, there is an ongoing use of social media, including Twitter and other platforms, which have been used for advocacies. Even my area, I research in women's health and health disparities, and we have been using webinars. um, all the meetings have been converted to virtual, and talks are being given on health disparities in patients with COVID-19 disease, also how COVID-19 disease impacts women and women who are pregnant. One of the other things which we did was, um, we had the whole issue on women's health and COVID-19 in patients with kidney disease, which was published in one of the journals, Advances in Chronic Kidney Disease, and covered various avenues, like how COVID-19 impacts patients with kidney transplant, how COVID-19 impacts patients on dialysis, how COVID-19 impacts pregnancies. So that was another area or avenue we use to advocate in these challenging times.